A goiter is an abnormal enlargement of your thyroid gland, which is a butterfly-shaped gland located at the base of your neck, just below your Adam's apple. This enlargement isn't a disease itself, but rather a sign that something is affecting your thyroid's normal function. The thyroid gland is a crucial component of your endocrine system, producing hormones that regulate many bodily functions, including metabolism, heart rate, body temperature, and even your mood. When you develop a goiter, your neck may appear swollen, sometimes visibly so, although not all goiters are large enough to be seen. It's important to understand that a goiter doesn't necessarily mean your thyroid is overactive or underactive. It simply indicates that something has caused the gland to grow beyond its normal size. Goiters can affect anyone at any age, though they're more common in women and in people over 40 years old. While some goiters are painless and cause no symptoms beyond the visible swelling, others can lead to discomfort and complications if they grow large enough to interfere with breathing or swallowing. Types of goiters. Goiters come in several different types, each with unique characteristics and causes. Diffuse goiters involve enlargement of the entire thyroid gland in a relatively uniform manner. When you look at or feel a diffuse goiter, the whole gland seems evenly expanded rather than having distinct lumps or nodules. This type is commonly seen in conditions like Graves' disease or Hashimoto's thyroiditis, as well as in iodine deficiency. Nodular goiters, on the other hand, contain one or more distinct nodules or lumps within the thyroid tissue. These nodules can be solid or filled with fluid, and they may grow at different rates. Another classification includes non-toxic and toxic goiters. A non-toxic goiter refers to an enlarged thyroid that still produces normal levels of thyroid hormones. In contrast, toxic goiters produce excess thyroid hormones, leading to hyperthyroidism with symptoms like weight loss, rapid heartbeat, and anxiety. Causes of goiter. Several different factors can lead to the development of a goiter, with iodine deficiency being historically the most common cause worldwide. Your thyroid gland needs iodine to produce thyroid hormones, and when you don't get enough iodine in your diet, the thyroid compensates by working harder and growing larger in an attempt to capture more iodine. This response is similar to how a muscle grows larger with exercise. While iodine deficiency has become rare in developed countries due to iodized salt, it remains a significant problem in parts of Africa, Southeast Asia, and certain mountainous regions where the soil contains little iodine. Autoimmune diseases represent another major cause of goiters. In Hashimoto's thyroiditis, the immune system attacks the thyroid gland, leading to inflammation and goiter. During the early stages of Hashimoto's, the thyroid often swells due to inflammation before eventually shrinking as the disease progresses. In Graves' disease, the immune system stimulates the thyroid, causing it to enlarge and produce excessive hormones. Both of these conditions are more common in women and often run in families, suggesting a genetic component. Thyroiditis, or thyroid inflammation, can also cause temporary swelling, whether from viral infections or autoimmune reactions. This inflammation typically disappears over time. Pregnancy and puberty can also temporarily increase the body's demand for thyroid hormones, sometimes leading to temporary thyroid enlargement. Certain medications like lithium for bipolar disorder or amiodarone for heart problems can interfere with thyroid function and trigger goiter formation. In rare cases, tumors, whether benign or cancerous, can cause the thyroid to enlarge due to abnormal cell growth. Symptoms of goiter. The symptoms of goiter vary widely depending on the size of the enlargement and whether it affects thyroid hormone levels. The most obvious sign is a noticeable swelling in the neck, which may range from a subtle fullness just below the Adam's apple to a prominent bulge that's immediately visible. This swelling is usually painless and moves up and down when you swallow. In some cases, you might notice your neck looks asymmetrical if the goiter affects one side of the thyroid more than the other. Some people describe a sensation of tightness or fullness in the neck, almost like wearing a shirt with a collar that's slightly too tight. As a goiter grows larger, it can begin to cause mechanical problems by pressing on nearby structures in the neck. You might experience difficulty swallowing, known as dysphagia, which can feel like food is getting stuck in your throat. Some people develop a persistent cough or hoarseness as the enlarged thyroid pushes against the windpipe or affects the nerves that control your vocal cords. In severe cases, a large goiter can cause breathing difficulties, especially when lying down or during sleep, leading to a sensation of choking or suffocation that can be quite frightening. If the goiter is caused by an underlying thyroid disorder, you may also experience symptoms related to abnormal hormone levels. With hyperthyroidism, you might notice unexplained weight loss despite an increased appetite, anxiety, irritability, trembling hands, irregular heartbeat, increased sweating, and sensitivity to heat. Your eyes may even appear more prominent, a condition called exophthalmos that's particularly associated with Graves' disease. In contrast, hypothyroidism can cause fatigue, unexplained weight gain, cold intolerance, dry skin, hair loss, constipation, and depression. Women often notice changes in their menstrual cycles, and both men and women may experience decreased libido. It's worth noting that many people with goiters maintain normal thyroid function and experience no symptoms beyond the neck swelling itself. These are called euthyroid or non-toxic goiters. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of goiter. To diagnose a goiter, your doctor will inspect your neck visually, looking for swelling or asymmetry, and then gently palpate or feel the thyroid gland with their fingers. During this examination, they might ask you to swallow, which makes the thyroid move upward and helps confirm that the swelling is indeed coming from the thyroid gland rather than another neck structure. After the physical examination, blood tests are usually ordered to check your thyroid function. These typically include measurements of thyroid-stimulating hormone, TSH, which is produced by the pituitary gland to regulate thyroid activity, and the thyroid hormones thyroxine, T4, and triiodothyronine, T3. These tests help determine whether your thyroid is functioning normally, overactive, or underactive. Additional blood tests might include thyroid antibody tests to check for autoimmune conditions like Hashimoto's thyroiditis or Graves' disease, which are common causes of goiter. An ultrasound is often the first imaging test performed because it's non-invasive, doesn't involve radiation, and can clearly show the size and texture of the thyroid as well as any nodules. If nodules are found, your doctor might order a radioactive iodine uptake test and scan. For this test, you swallow a small amount of radioactive iodine, and a special camera measures how much is absorbed by your thyroid and creates images of the gland. This helps identify areas that are overactive or underactive. In some cases, a fine needle aspiration biopsy may be performed to extract cells from the thyroid for analysis, especially if thyroid cancer is suspected. Treatment for goiter. The treatment for goiter depends on its cause, size, and symptoms. Here are the different treatments available. Number 1. Watchful waiting. If the goiter is small and not causing any symptoms, the doctor may recommend a watchful waiting approach. This involves regular monitoring of the thyroid gland through physical exams and ultrasounds to ensure that the goiter does not grow or cause complications over time. Number 2. Iodine supplementation. In cases where goiter is caused by iodine deficiency, increasing dietary iodine intake through iodized salt, seafood, and dairy products can help restore normal thyroid function and reduce gland enlargement. In some cases, iodine supplements may be recommended under medical supervision. Number 3. Medications for thyroid regulation. If goiter is caused by an underlying thyroid disorder, medications may be prescribed to regulate hormone levels. In cases of hypothyroidism, levothyroxine is commonly used to replace missing thyroid hormones, helping to shrink the goiter. For hyperthyroidism-related goiter, antithyroid medications such as methimazole or propylthiouracil may be used to reduce excessive hormone production and control symptoms. Number 4. Radioactive iodine therapy. For individuals with toxic goiter or hyperthyroidism, radioactive iodine treatment may be used to shrink the thyroid gland. This treatment works by selectively destroying overactive thyroid cells, reducing hormone production and goiter size over time. Number 5. Surgery, thyroidectomy. In cases where the goiter is large, causes significant symptoms, or is suspected to be cancerous, surgical removal of part or all of the thyroid gland may be necessary. Thyroidectomy is often recommended for nodular goiters that cause breathing or swallowing difficulties. Number 6. Treating underlying inflammation. If goiter is due to thyroiditis, managing inflammation with anti-inflammatory medications or corticosteroids can help reduce swelling and discomfort. Treating the root cause of inflammation is essential for preventing further thyroid enlargement. At the end, with proper diagnosis and appropriate treatment, most people with goiters can manage their condition effectively and maintain good quality of life. Now, we want to hear from you. Have you or someone you know experienced goiter? What symptoms did you notice first, and how was your journey to diagnosis and treatment? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.